Hi, hello, good afternoon, good morning, good evening, depending on your time zone. This is Dr. Heather Stanley coming into you again. I'm a pregnancy specialist for those who don't know me. So we're going to pick up on, continue on with sickle cell disease. And I wanted to touch base because a couple of my patients are a little confused about how they have sickle cell disease, but there appears to be nobody else in their sibship or their parents who have sickle cell disease. So before I get into the weeds a little bit, let's just make some definitions. So we all know that we have genes, and genes is just a coding thing to tell our body and give our body instructions on how to make molecules within our body. So for sickle cell disease, the genotype is that code. So for people who have normal hemoglobin, the genotype is universally known as A, capital A, capital A. So that means the code in your blood that makes the hemoglobin that carries the oxygen is AA. So what is the phenotype? The phenotype is how a disease manifests. So if you have AA, then you're not going to manifest sickle cell disease because you have normal hemoglobin. So manifestation of disease is phenotype. A person who has AS has a phenotype like a person who has normal hemoglobin. However, when they're going to make their babies, they can pass on that S gene to the baby. That becomes important in a minute, so stick a pin on that. And then you have the genotype SS, which are people who have sickle cell disease. So their phenotype or their manifestation is that they have the disease from birth, they have painful crisis, and all of the things that come with sickle cell disease throughout their lives. Okay. So remember we talked about the person who has AS, who for all intents and purposes are normal. Exceptions are when they go to high altitudes, then sometimes they may get some achy bones because the oxygen level as you go higher up above sea level, the oxygen is a little thinner, and so those S hemoglobin might cause a little bit of a painful crisis, not too bad. Or if you're AS and you're pregnant, you're prone to a lot of urinary tract infections in the pregnancy. Now, when you have two AS people coming together to make a baby, you have to donate one of the two codes. So you can either donate the A code or the S code. And the same is true for the other partner. So a baby might have AA, which is normal, AS, where they're carriers, like their parents, or SS, which has disease. So that's called autosomal recessive inheritance. In order to have sickle cell disease, you must have two parents, one of whom has the S code and the other one has the S code, and those two S codes must come together in the baby in order for baby to have the disease. That occurs in 25% of each pregnancy with that particular couple. So that is why, we have a lot of blended families, but that is why if you have same parents and you are affected with sickle cell, you may have siblings who are not manifesting disease at all, and you might be the only one because it's a 1 in 4 chance that, children from that coupling will have disease. So that is how it is inherited. it becomes important if you are planning on a pregnancy and you know that you're a sickle cell disease person, so you have SS, it means that by yourself you can only contribute the S code to your baby. So your partner ideally should be tested to see if they have an S code or some other hemoglobin code that's different than A, so that we can do a proper risk assessment to the baby. Now, newborn screening will pick up babies with certain sickle cell disease types, including SS. Genetic counseling is available, and there are also other testing that may be available to parents who might be interested in seeing what the risk to their fetus is. So that is the long-winded answer to why is it that I'm the only one in my family that has sickle cell. My parents don't, my siblings don't, and there are no other people like aunties or uncles that don't have it. Usually it's a disease that comes into the family pedigree by virtue of mating. Okay, so stay tuned. Next week I will have some other information about sickle cell disease in pregnancy. Maybe we'll talk about advances in treatment for sickle cell outside of pregnancy and future family planning. This is Dr. Heather Stanley Christian, wishing you a wonderful Wednesday. I want you to breathe, and I want you to walk good. If you want to know about us and see how we take care of our ladies in our unique way, please come find us at unitymfm.com or at unitymfm on Insta or Linktree. Walk good and have a blessed day. Peace.